This 18-year-old patient was referred to me for examination, evaluation, and endodontic retreatment of tooth number 14. According to the patient, the root canal was done a few years ago, so perhaps maybe when he was 14, 15 years old by his previous dentist, okay? So he says about a month ago, he noticed a pimple on his gum. He went and saw his dentist, and the dentist told him that the root canal had failed and referred the patient to us for examination. So take a look here. You can see a porcelain crown on the tooth, previous root canal. You can see a large periapical lucency right there, okay? Now also take a look. The distal buccal was filled short, no periapical lucency, right? The palatal was filled long and no periapical lucency. So remember Dr. Lin's study? The extent of obturation has no bearing, doesn't have a negative effect on the outcome of the endodontic treatment. What determines the outcome of endodontic treatment is whether or not you left bacteria behind, or in this case, you left bacteria behind because you missed a couple of canals. So I'll show you. So again, you can see the large periapical lucency, okay? So the extent of obturation, as you can see, doesn't affect. Look at this, beautiful obturation all the way to length, but the mesial root has failed because the dentist left necrotic tissue and bacteria behind in the missed canals, the MB2 and the MB3 canal that he had missed. Also, of course, the dentist had ordered a CBCT. Why? I already know what's going on. I already could see the periapical lucency right there. And without looking at the CBCT, I could tell that there was missed MB2. I didn't know there was a missed MB3, but I knew there was a missed MB2. So missed MB2, missed MB3, missed MB4, missed DB. I can find them. I don't need a CBCT. I already know where to look for those canals. So anyways, that's the CBCT that the dentist had ordered. And take a look here. So that's the tooth here, and you can see a sinus tract also associated with the tooth right there. All right, very good. So again, the patient is only 18 years old. So we went ahead and redid the root canal for him in one appointment. Kind of selective endodontic retreatment. So take a look here. All right, so you can see the missed MB2. There was actually a MB3 also, so I found MB2, MB3, and then once I instrumented MB2 and MB3, they joined. All right. So as you can see, missed MB2. I removed some of the gutta-percha out of the distal buccal canal and out of the palatal canal, and they were clean. There was no contamination, so I didn't break the apical seal on those. All right, but as you can see, everything went beautifully. Take a look here. Look at that beautiful lateral right into the lesion there. That's a nice lateral right there. You can see right there, right there. All right, so we can see it again here. All right, but as you can see, everything went great. Again, you can see palatal is obturated long. There is no periapical lucency there. Distal buccal obturated short. No periapical lucency there because there was no bacteria in those canals. The reason the mesial root had failed was because there was bacteria in the MB2 and the MB3 that this dentist had missed. All right, so as you can see, everything went great. We went ahead and temporized the tooth and referred the patient back to his dentist for the permanent restoration. Again, we always ask the patients to come back. We schedule them to come back to see us for a 6-month post-op. When the pain and the infection and everything goes away, the sinus tract, the swelling goes away, then they usually don't show up to their appointments. But we did schedule them for a 6-month post-op. Hopefully it will show up, and if he does, then post that video for you. But here you go. We did it again in one appointment. Redid the root canal in one appointment. All right, very good. All right, excellent.